and you have been rocking with the team. Now we get into a serious conversation, and we're talking about compassion. That is Humanity First Uganda. It's not the first time you're seeing them on set here on UBC TV. They do come most of the times when they have something up. Humanity First, we're talking about things like volunteering to support health, boreholes, many other activities. The list is endless, but most of the times they do come out and set here when they have held a free medical camp, and they had one in the eastern region, and it is quite amazing to see that people out there, especially in some of those areas, are struggling. It is not, how should I say, healthcare is not affordable. It is accessible but not affordable. So when such camps come, they show up in big numbers, and they're attended to where they get general medical care from specialized health practitioners, because the team ensures they bring as well specialists from outside Uganda. Then also the feeling of like getting free consultation, because I do see most people here on Wednesday when we have an opportunity to have specialists. It's a time for them to address their issues. I'd like to say thank you to Humanity First Uganda and Global Health for ensuring that these services do come out to us. Gentlemen, a very good morning. It's a pleasure to have you on set.
Good morning. God bless you. Thank you for having us.
Okay. Now I'd like to request you to introduce yourself, because I know you have quite a number of titles, and somebody will think you're only in the medical field, but you also have other bits. Please, I'll start with you.
Sophie, thank you so much for having us. It's a huge honor. My name is Aziz Hafiz. I serve as the chairman of Humanity First United Kingdom. We are a partner and supporter of Humanity First Uganda. In my other role, I am a family physician, and I am a trainer of family physicians in the United Kingdom, as well as I lecture at the medical school at Leeds University.
Wow. So we classify you as Dr. Aziz. Okay, then please.
My name is Abdi Chwanuka, and I am the Vice Chairman, Humanity First Uganda, and as well I work as the Director of Gift of Sight, the annual camp. I usually come here with Chilabo whenever we are having that camp. But as well, I work as a laboratory manager at Metropolis Healthcare Uganda Limited, and I think that's just medical laboratory personnel.
Wow, that's interesting. Now I would like to ask about, you know, when you talk about it, I can see all medical personnels, and I think that's where we draw from the interest for the free medical camp. I'd like to first start with, when we talk about Humanity First, we were chatting out there and you told me something quite interesting. I would like you to share with me a little bit about, I never take it for granted that everybody knows what we talk about when we mean Humanity First.
So Humanity First is an international development and disaster relief NGO that was founded in the United Kingdom. It was originally founded in 1995 by the Ahmadiyya Muslim community, but it was founded as a non-religious, non-sectarian NGO serving all walks of life, all nationalities, all backgrounds across 60 countries of the world. Humanity First Uganda is one of the longest established Humanity First branches in the world, and we cover primarily two areas: disaster response, emergency help, and development, like health, etc., as you've described. Mm-hmm. And we also cover food security, agricultural issues, health we've covered, education, so civil contingency in terms of preparing people for disaster preparedness with a lot of extreme weather environments, floods, tsunamis, all these things. You know, we have a lot of mudslides here in Uganda. So this is, in a nutshell, the areas that we cover.
Okay. Now I'd like him to tell us about this time. Most of the times, we've not seen you hold a free medical camp around Kampala. You normally go to those areas. Okay, why the area that you chose? Because 6th to 8th you were in Kaliro, right? Mm-hmm. Yes. Why Kaliro? And that's just what I would like to, how do you identify the spots where you say, this year, this is where we're going to have the free medical camp?
When you look at the very fundamental principle of Humanity First is reaching out to the misfortunate ones, reaching out to the poorer communities within our societies. And when you look at Kampala, the average person in Kampala can easily afford health care. And there are many health care facilities within Kampala. The main referral hospital is in Kampala. Actually, I think we have like 3. You have Kawempe, Mulago, Chirudu, you know, and then a lot of private facilities as well. So health in Kampala is not, I'm not saying it's not at risk, but the risk is minimal as compared to Wangala, where we were, that an average person there cannot afford 4,000. Doctor would tell you the story, 4,000 in Kampala to move from UBC to go to my place of work, I need 5,000. So if I'm able to keep it in Kampala and moving every day, I can afford that. But you go to Wangala, these people cannot afford 2,000 shillings to 5,000 shillings for even cooking oil for their food. And yet they have to walk for 30 kilometers to a health center for, not even a referral, but a health center for, they have to walk 30 kilometers. So when we look at when Humanity First, we usually sit down and then we look for the most affected ones. We look for those people that where our services would be of greater effect and impact. That when we go there, these people get a chance to see a specialist. These people get a chance to get free medical care when they have not walked long distances. So even this cuts across the different programs that we offer, that we want to touch the life of those ones who are most affected.
Now, you said it's your second time to come to Uganda.
Yes.
What was the feeling like for you when you were out there with those thousands of many people and you had to address their issues?
So it's a difficult question to answer because you feel, and I will try to find the words, personally, I feel a sense of personal embarrassment. What I mean embarrassment is that I live in a country where I don't want for food, I don't want for healthcare, yet you feel embarrassed that I'm blessed with the ability to have food when I want, water when I want, healthcare when I want, and yet now I'm faced with hundreds of people that don't take those things that I take for granted. I never have to wonder where my food is going to come from, never. And yet here, don't know where the food is going to come from, don't know how. So there was that first feeling, and the second feeling is that as an organization, we are not doing enough. We need to do even more, even more, even more. So these are the two feelings, and you may feel what an unusual feeling he has, but yes. So there's a feeling of humility and that I am so fortunate, and on the other hand, we need to do so much more as an organization. You can never do enough. So lack of satisfaction that yes, we've helped 1,000 people, but we need to help millions. So these are the two sort of drivers for service, really. Drivers for service that you can never stop. So it pains you to drive you further.
Now, with what you were seeing there, what were the most, how should I say, what medical conditions stood out most? Because I believe some people, it could have been their first time to come to the health camp.
Many, many people. So there were, over the course, we probably treated, and I also was serving as a doctor there as well, even though I'm coming here as a volunteer, over 1,000 patients. The mainstay of conditions, and as you will no doubt know, in the Uganda setting, there are a lot of chronic infections, chronic gynecological infections, because there is no access to health care. So there will be people that will come, oh, I have had low back pain and this discharge issue for 1 year. And it can cause, and why, and in the UK, I would be saying, why are you coming to me after 1 year? You can't ask this question here, because they've not had the resource or the ability to be able to see someone. So that leads to serious complications. Many issues of renal problems, there was many renal problem issues, lot of long-standing chest issues. There were some very painful cases, painful cases, women with children that suffered with undiagnosed epilepsy, seizures on a weekly basis, did not have the capacity to seek medical help, went to see a faith healer with the hope that you will receive something, given some inappropriate advice, unfortunately, and really, really, really suffering. So there were so many cases to talk about, so many.
Now, I know for you, you'll be flying back. Now, let me get to him. Now, with some of those that have happened there, do you have a plan for follow-up? Because you start on something, you have to make sure you finish it. Because if he talked about the cases, let's say like epilepsy is a lifetime condition, yeah? Somebody will still continue, the child will still keep having those seizures. Did you leave them with a plan like, okay, now if this happens, this is the first aid you're supposed to administer, or this is where you can go to the health center 3 or the health center 4 that is close within your vicinity? I'd like to beg you to help.
So how we managed that, we dealt with the patient directly. So it was a young 6-month-old boy. And although we deal with the immediate issue, we take direct contact details. So our deputy head of global health, Mr. Hakim, who's in charge of our program there, we pass the details. So our referral pathway is that our department takes her details. So they both sit together. They know that in 1 month time, you will contact us and we will send you to this healthcare center, not to a private center. Don't visit any private center for risk. Sadly happens across the world. When there is private medicine, there is a financial incentive, and sadly poor people do get exploited. There is no denying. It happens across the world. And we already contact that healthcare center. Okay. So this lady to monitor, because with epilepsy you need to monitor those drugs. So it will be a monthly monitoring for 3 months. After 3 months it will be a 6-monthly monitoring.
Okay, that's
and then that medication will be provided long term. And then she was extremely poor. So she is the lady that didn't have the 4,000 shillings for transport. So we then provide immediate financial assistance to provide for her transport back and forth. So this is an example of follow-up, because exactly as you said, there is no point me helping her today and then tomorrow she's nothing.
Yeah,
so that is some example. And then with similar cases, whether it's eyes, anything else, we will put places in within our limited resources.
Okay. Now he's talking about the limited resources. When you say limited resources, one is like, really? Where does the money come from? To you.
Thank you very much. Now, with Humanity First, like Dr. Sabi is saying, our strongest base or weapon, it's not the resources, the financial resources. It is actually the human resource. And even to the point is trying to explain that when we hold these medical camps, we have 1, 2, 3, 4 personnel from Humanity First. But if you try to imagine the 1,000 patients that were in the Wangala camp, you couldn't see them with only 2, or doctor himself couldn't see the 1,000 patients. So Humanity First does the empowerment aspect, that if we are coming to do a medical camp, we don't come and do everything as us. We work with the local communities. We work with the local health communities, the authorities. We had authorities coming in from even the leadership aspect. Sometimes we have the RDCs coming in, the district health people also coming in, and we work with the health facility there. We have aspects of sensitization, training, and then we help, we set forward, like he was explaining, even that follow-up plan. And in case the patient comes back, what should be the immediate aspect? So if at all we've done any kind of procedures, you need to look and see, follow them up and see if there is any other secondary cases coming in. So the finances, they are the least of our worries, because the moment you're having a doctor coming from UK, we had about five local doctors here. We had about 3 coming from Kampala, and then most of them, they are taking care of their welfare to see that they can, and then they are contributing to Humanity First. So Humanity First is we don't have a given funder seated somewhere, like Dr. Sabi is telling you, he's our boss, Humanity First.
I'm nobody's boss.
And when you look at him, he doesn't have 100 millions to be sending us every time. He doesn't. But the base is what I can give to Humanity First, what Dr. Sab can give to Humanity First, what the community, every time we come to UBC, we say we are calling out to all the people out there to join Humanity First drive. Because when you look at what we spent in the camp, roughly 10,000 Ugandan shillings per person that we saw. So when you look at, when you have free human resource, the medication are very cheap. The other consumables are very cheap. So any normal Ugandan can manage to take care of one person in a camp. So we need few Ugandans to donate a few thousands, and then we are able to hold a medical camp. When you look at the orphanage that we have in Kabende, and how much we are spending to feed the young ones, to dress them, they are pennies. So if one person is out there and then he gets this call of Humanity First, we don't have angels. We only have us. We have you out there. You just need to join the call. Donate to Humanity First. What you donate to Humanity First will touch hundreds of lives. We do cataract surgeries, and I've repeated this year. In Kampala cataracts, you need 1.5 to 5 millions to have a single eye operated.
Yeah, true.
Humanity First is spending less than 200,000 to have an eye operated, pre-treatment, post-treatment, during surgeries, because we have volunteering ophthalmologists. We have volunteering ophthalmic clinical officers who agree this month, during our leave time, we are able to offer the services. We have nurses who volunteer, and they're like, we are ready to offer the services. And then many of them even contribute to the fact that we are going to give this money, 200,000, which is very little. And then you're going to save someone, like Dr. is saying, we have people who have spent 7 years, 10 years without seeing, simply of that 8-minute surgery. You get. So this is the main call, that the finances are from us, and it is as low as 10,000, 100,000, 200,000, whatever you can donate to Humanity First can change a life.
That is interesting, yes.
I would just add, if you permit, so we have a motto, our patrons, on this issue, that maximum utility and minimum resource. So do the most you can with the least resource. So we don't receive any government funding, we don't receive any institutional funding. It is literally, as we were talking outside, it is knocking on the door. So our role here in the UK and also is to try to access those funds from noble people that want to help their nation. So charity cake sales, our ladies fundraising team is also here with me, and they have been working extremely hard prior to this visit, raising tens and tens of thousands of pounds for our efforts across Africa and within Uganda. So these are all individual, one-to-one efforts, and as our Vice Chairman has said, that even here in Uganda, yes, there is extreme poverty, but there is also wealth as well. There are great servants of the nation who have been blessed, and what more pride can you have to be able to give something back to your own country?
Yeah, true. Now there is another issue. There is once I attended a free medical camp still, and what I realized still in those vulnerable communities, the excitement is there. We're having medical experts coming, specialists. Now they're going to be there possibly because of the queues and the numbers for the whole day. Yeah. In triage, of course, I know you try to separate who has what issue based on what they have explained, and then they are placed differently. You know, to see this different specialists. Comes in the food aspect, because if somebody cannot afford 4,000, that means they possibly even can't afford food. How do you support when it comes to that? Because it's really like you have to give with wholeheartedly.
Yes. Yes. So again, when you are doing your needs assessment of the population that you're serving, needs are never isolated, as you've said. So when you are trying to address health needs, you will find many other needs as well. So in the example of food, we will look at case-by-case basis. Where there are any direct emergency assistance we can give, that will be given directly, whether it's direct cash assistance at that time. In terms of long-term assistance, we are looking particularly female-led households where they are the sole breadwinner, looking at agricultural support, looking at giving them the tools, the skills to be able to become strong subsistence, almost to be able to earn food for themselves, but to sell as well, to make them stand on their food, on their own feet. The whole of give the person a fishing rod rather than a fish. So this is something that we're very keen, not only in Uganda, but across Sub-Saharan Africa, West Africa, East Africa.
Okay. Then what about, of course, given that you're there, did you carry out any surgical procedures? Did you have any of those critical issues that required extra beyond where, let's assume if it is where it is, the referral has to be done to a bigger hospital within the area?
So in medical service, particularly in a low resource setting, the key areas are general medicine, which is what we are covering. Then there are general surgical issues. So these are your two major. And then you've got speciality in terms of neurosurgery and very. So in terms of general medical, the camp was a general medical camp, although we have surgical expertise there. But if, to answer your question, there was a requirement for surgical cases, and then there were a number of cases that did require, so there were some chronic hernias there were some children with grossly extended umbilical hernias that have been waiting for a number of years, but now the time has come. So those we would then refer on to the national referral centres. We would communicate with them to ensure that there was a clear explanation. In extreme cases where there were financial concerns and the needs were huge, we would then financially support also.
Oh, wow.
Yeah.
Oh, wow.
So we try, you can't achieve everything, but we try to do an A to Z service where we can. And you have to prioritize. Ultimately, you are rationing. You have to decide, there are 100 people, you have ability to help 20, and you then have to prioritize which of those 20 are the most needy. In an ideal world, you'll be helping everyone. But the reality is not that, sadly.
Okay. Now I'd like to find out from you what, I believe each year you've also attended all the free medical camps that you have done as Humanity First. What was it like, or what was different about this particular medical camp from the one you attended last year?
Actually, I think there is no difference. There is no difference, and we usually find the same challenges. And like doctor is explaining to you, someone having such issues, and then they are waiting for years and years. And you know, for most of us here, it might sound like it is impossible, it cannot happen, but the greatest danger we have to our healthy well-being as a society is ignorance. And very many people there, usually when I speak, I usually say most giving in reference to gift of sight where I am. So you just think of someone down in Kapchora or wherever you might find them. If they start losing their sight, you know, and they don't know, life will continue. And many of them, actually I think over 80% of the cases we've worked, they just lost sight and they didn't know. And then they just kept home and sat. Until we come and we are looking for, we have a free medical camp, and then their village health teams organize and mobilize, because they'll be knowing where these cases, and they bring them. And then by tomorrow, someone is seeing after 5 years. You get, so the same cases, when you go there, you'll find all they need is to tell them what to do and what not to do, how to live a clean and healthy life. So to me, these camps are usually the same. We change the locations, but the problems are always the same. So the need for what Humanity First is doing right now, you cannot say that we'll be like Doctor is saying, you cannot exhaust everything. We are just touching a drop in the ocean. But Uganda has a lot of communities. I appreciate the government of Uganda have moved around different local remote areas, and then you find the health facilities are there and all that, but still they are not adequate. That's why when it comes to working with the communities, sensitizing them, and then creating that general, because this is what Humanity First does. It is basically creating sensitization that people need to know. They need to be aware of their health. They need to know what effort to put in to be able to improve on the quality of their lives. So basically, there is totally no difference for me. They are still the same. You'll still find the very needy people who cannot afford something small, and even you wonder if they are able to feed themselves. And then you do what you can do, what God enables you to do. We have community care that when we are able to find out such families that may be not able to take care of themselves, when we get a few donations for community care, we are able to reach out, give them some food, give them some soap, give them some materials to use at home. And we have food security. We've been able to look out and find some of them have land and then they don't know what to do, or they have poor seeds and all that. We educate them, we give them these good seeds, and even animals, maybe goats or cattle, we give them, and then we see that at least we can try to improve their lives. And lastly, on the other aspect, what Humanity First does, that today we find you a needy person and you're a beneficiary in this program. Tomorrow when we come back, we recruit you as a donor. So when we come and give you the seeds, and then we educate you, and then you follow the advices of our volunteers, and then you're able to harvest, you're able to take care of your goats and cattle. So next time we come back, you who didn't have at the start, you'll be the one again giving back to the community. And we want this to grow out extensively throughout the entire community in Uganda, to create that kind of mentality that it all begins with us, and we can cause an effect, we can cause an impact, we can change the quality of our lives.
Okay, before we get into a very short commercial break, I would like to ask, how easy is it to mobilize, and how long does it take you to mobilize these communities? Because by the time you have such a huge crowd, you have been doing massive communication, or I don't know how you've been doing it to them, to be able to ensure that this is the location, and who helps in ensuring that even the person at the lowest level is able to come and attend.
Like Dr. Saab can tell you, I think we got his communication like in a month.
Yes, even less than that. So there was a weakness on our part due to varying logistical challenges and other disasters across the world. Particularly, we are very heavily involved in the Middle East, in Gaza at the moment. We had juggling many balls, so we gave you, sadly, very, very short notice. I think it was probably just over a week, 2 weeks.
That you're coming down.
So, but we knew we were the planning for the project, so they did miracles, and they'll tell you the miracles they did.
So, like what I said, the beauty with Humanity First, when people get to know that there is no one coming to rescue us, there is no one coming, and then those very people are empowered. Those very people are told that you can do it. Because basically, many times you'll find that that's what is missing. So like I was saying, Humanity First, we don't work with angels. We work with the very people. So even if Dr. Saab tells me now that can we have a camp tomorrow, we can pull it off. Because all we need is to call our volunteers. We call those health centers. And then when we talk to them, they do their own mobilization. They already tell you, we have these conditions in this area, we have this and this and this, and then we are able to have the information. So how we usually do it is we work with the very people that are affected, the very people that need this service, and then recruiting them, because we've been doing these camps every year. Now the frequency is increasing per year. And these very people, we don't work with them, and whenever they see Humanity First, they don't expect a penny from Humanity First. They know Humanity First is not bringing anything. Humanity First is, he wants them. Humanity First wants them. So we leave them, we leave these communities and these volunteers knowing they are the Humanity First. So when tomorrow we want someone who is in need, we just call them, and they know that there is, you will not have a very big budget that we are going to do this, there are 100 million there. They are not there. Humanity First, we always have 200,000 because someone has deducted from his 1 million of salary and offered 200,000. And then when we make simple calls, like I said, in the health sector, we work with the village health teams. They are able to reach down to everyone. Then the district health officers, and then the hospital administration, and the entire RDCs, and they all know about human. This is why when we have our camps, last time we were in Paris and all that, these health authorities come to our camps, and then they appreciate, and then we tell them openly, we've not done anything. You're seeing your very health people working on them. Doctor can tell you, the very people in Kalilo were the ones seeing their own patients. So all that Humanity First does is to sensitize them, to let them know there is no help coming from anywhere. They themselves are the help.
Okay. So at this particular point, I would like us to take a very short commercial break. When we do return, we're still going to continue with this conversation.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
It's our mission to secure your money.
Protecting your money is as important as earning it. It is for this reason that the Deposit Protection Fund of Uganda, DPF, was established by the government of Uganda to provide deposit protection to customers of regulated financial institutions. In the unlikely event that your commercial bank, credit institution, or microfinance deposit-taking institution fails, the DPF will pay you up to 10 million Uganda shillings. Keep your personal information such as national identification number, mobile phone, or an alternative bank account updated with your banker. Terms and conditions apply. For more information, contact DPF at Aha Towers, Plot 7 Lodell Road, Kampala. Call 0312-206-400 or visit our website at www.dpf.or.ug.
We are the DPF. We protect your money. Protection Fund of Uganda.
Are you a woman with a small-scale business with a dream of growing it to another level? The GROW Project is here to support you in realizing your dream.
The GROW Project is a government initiative implemented by the Ministry of Gender, Labour and Social Development and Private Sector Foundation Uganda with support from the World Bank.
We support women-owned businesses across the country to gain hands-on and business management skills through training within your location, business financing through grants and affordable loans, and infrastructure in your areas of operation to enable you to increase your productivity.
If you have a business that makes sales of up to 800,000 Uganda shillings per month, the GROW Project has the tools and resources to help you succeed. For more information, contact your district or city GROW focal person or call our toll-free line on 0800 307 777 to learn more about how you can benefit from the GROW Project's services.
The GROW Project, empowering women economically, transforming communities.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
Welcome back from that short commercial break. We're still talking Humanity First, and we're talking about the free medical camps that they do hold, but they also do many other amazing things besides that. Now, Doctor, I get back to you still. Now, from this whole bit, you know, because still in my mind, a lot is drawing. In terms of mobilization, you did talk about how the communities are involved. But now, how do we empower some of these health centers within that region to be able to ensure that they can fully support and have maybe affordable health care?
So healthcare is across the world, not only in the developing world, also in the Western world. Managing healthcare, it's a never-ending need, and resources are limited. If the resources are limited in the West, they are hugely limited here in Africa. So you have to work within the limited resources that you can. The government of Uganda is making huge efforts to try to help and empower these healthcare centers 1, 2, 3, and 4. Where we, as the charitable sector, we work and coordinate with them, that where there are gaps, and the gaps are huge, as you've heard, to try to make sure that we are regularly filling those gaps. and connecting them to the and information and ignorance is a big issue. So people, I talk about exploitation, and people are exploited genuinely, not only here but everywhere in the world, that, oh, you've got this condition, yes, you need to go to this private clinic, and this will assist you. When actually empowerment means, yes, you have this condition, actually you don't need a 30,000–40,000 pound procedure. Actually, this will only cost £2,000, and it will be done in this healthcare centre. So sometimes honest, genuine information can actually save them. So you're actually helping the health of the nation by ensuring that they're managed appropriately in the appropriate setting. And this happens, sadly, everywhere in the world. There are unscrupulous clinicians that may feel that, okay, this is a chance to earn some funds, so please visit my private clinic. So we are keen to empower patients with knowledge about their health and knowledge about their treatment as well, and appropriate treatment. And appropriate treatment need not necessarily be the most expensive.
Okay. So did you have at any one point amidst the camp some sessions where there was some health education? Because, you know, we normally have these myths of the child has a hernia, that is witchcraft. Yes. Please go to the shrine here and there. Absolutely. Which Dr. So-and-so will be able to help.
So yesterday, this was a prime example, one of our mental health supporters, who also happens to be my vice chairman, Mrs. Richardson, she's also a volunteer with Humanity First, and she was also seeing cases, and she saw exactly such a case. So there was a child with long-standing abdominal issues, and the patient came to myself and was told that the pastor has told us that there is some, what's the word, so put a spell on somebody, like a bewitched type of thing. And you need to come and visit the pastor regularly, and there is a fee for this. And I realized that as she was explaining this, and you can't just laugh at that and say, oh, this is terrible, because they believe that. So you need to very carefully, so firstly we medically check, make sure that there is no medical issue that I can find. Once I've confirmed that, then we refer on internally to our, what we call a social prescriber. In this case, Mrs. Richardson from the UK, and she has a local translator with her, also one of our local counsellors here from our own team here in Kampala. So they saw this child, they spent a good 40–45 minutes with the mother, and from the feedback that we've got, she was very much reassured because somebody spent time with her, not to necessarily criticize the pastor, but to say, actually, you know, we've assessed you medically. Medically, there is no issue there. There is psychological support. We will support you. We will continue to maintain in contact. So there are many things you can do to prevent people being unnecessarily taken down a path that will not necessarily achieve them any treatment.
I understand.
So a huge amount of psychosocial burden, huge.
Okay, now despite the challenges, there are also success stories that you witnessed for the 3 days you were in the medical camp. What are some of those bits where you feel like, as Humanity First, yes, we have nailed it?
With the Humanity First now, first I would like to appreciate the community in Uganda, basically being from the medical field, the medical personnel, because while at university we are usually, while back in the medical school, our main principle is to put health first. Yeah. And that's why it's very rare, actually, it's very rare to find a doctor who is rich, very rare. And when you find one, they are rich because of some other practices, maybe they do maybe any other businesses or something, but not basically for coming and seeing the patient. And any medical personnel, our main, whenever we see a patient, we don't think about billing, like Dr. Sam is telling you. It is not always about the price. Many times when you talk to the doctor, sometimes they just have a chat with their patients. Maybe it's just anxiety, maybe it's stress, and after that the patient is fine, doesn't have to pay coin. So this spirit is so much engrossed in the society of the medical people in Uganda. For the number of times we've worked, we've not held any medical camp and and has failed to be successful simply because the medical personnel were not supportive, because we would not even have any in case they are not supportive. So this other camp, when they told me they were seeing 300 patients on the first day, you know, and then we are having 5-6 doctors going, and then you are seeing over 400 on the second day. You know, by the time you're making 1,000 patients in 3 days, and this is in a far place where people are not taking taxis, people are walking. So if you're having 1,000 people walking to the site, to the medical camp, it's a great success. So for Humanity First, it's a great success that our work has been appreciated by the communities, no matter where we are going. If we say we are having a camp in Mbarara, we are having a camp elsewhere, as long as anyone sees Humanity First. So the people have trusted us, that even if you go to the authorities, you don't need to explain a lot. And some of this success we attribute it to UBC here being the country's broadcasting main channel. And then any office you go to and you tell them we are having Humanity First, we are having doctors coming, we are having this, we are having this, they are always supportive. So this is one aspect, and the main aspect, and the foremost success to our camp. But either way, also touching lives, like I've told you, to me, these camps are always the same. And a number of times when I speak, I see my eyes getting wet. Because many times when we are here in the comfort zone and we start thinking about America and all other countries, and we think those people are doing well, you know, and doctor comes here and tells you he's having over 2,000 food banks. Like, you know, when you're having 2,000 food banks, so each food bank can serve a number of hundreds of people. So these are people who are going hungry in the UK, and you come back to Uganda where it's very hard. I've not heard of it, where someone is dying of hunger in Uganda. You get, so for us, we don't have to think of what we are going to eat, you know, but then we are having other problems. So when you're in the comfort zone here and you're not out there, you think everything is fine. Yes. But when you get there, and then, like doctor is telling you, you're touching lives. You're seeing people who are suffering over a very small thing, just telling them, wash your eyes every morning. That's all they need, and then their eyes will be fine. You're working on people who you just need to tell, whenever you're going to shower, ensure your bathroom is clean. This is all they need. And they are not getting it because the facilities are very far to reach them. And then this kind of thinking, maybe someone is bewitching, and you'll be there with your UTI year in, year out. And when you go, they exploit you, you treat it, you come back, you get it again. So during this camp, we have the medical education, we have this kind of late sensitization to let people be more aware of their health and to improve their lives. So this is, and this cannot be one story. There are many stories that we find, and for all our volunteering medical personnel and non-medical personnel, it's always what drives us again to another camp. Like, we can't wait to go and touch lives. So this is basically the many sciences, stories you get. Dr. Sabu will tell you something different that touched him. You go to one who was registering, another one will tell you, this old woman came here walking like this to see this, and when I registered, and they will feel like this really gives us the reason to live, you know, because in life, it doesn't matter what you're achieving, but how you feel matters so much, that even when you give up everything, this is what will give you the reason as to why you lived, because these are some of the successes that you cannot get elsewhere. And this is our main call, that if you are a doctor, if you are, whatever you're doing, you can extend that extra hand to someone else who might be in need of your service.
Okay.
And we also would feel that it's very important to stress that in the NGO sector, in our sector, the humanitarian sector, a misconception can easily be felt that we, as doctors coming from the West, are somehow doing Africa a favor. Whether you feel that with ill intention or even with good intention, We're all human beings. We all carry our weaknesses with us. But it's very, very important. And in Humanity First, we're very keen that when we're selecting our staff, when we're selecting our volunteers, it's very clear that they are not coming on humanitarian tourism. They are not coming on some superhero complex that I am here come to save the world. Very, very important, because if the intention itself is not pure, your results are not going to be blessed. You're not going to actually put that energy there. So in fact, it's the opposite. These communities that we talk about, these communities are doing us a favor. I could give you a list of things over the last 4 days, and I've been serving as a doctor for more than 20 years, that I have learnt here. And I may feel, okay, what am I going to learn when I'm going to go to Uganda? I can swear to you the things that I have taken from not only the patients that I've seen, but from my brothers and sisters who I've worked with. So I am going back to the UK more blessed with more knowledge, more skill, more understanding, more awareness. So I personally feel that I haven't given anything, but I have received plenty. And as an organization, our patron has advised us a very great motto, that we are here to wipe away the tears of the distressed. And as long as you can remember that, then I think all your service is set for success. Because if your foundations are weak, if your foundations are based on financial gain or gain of notoriety or some other gain, then we as an organization don't believe that long-term your efforts will be blessed. They have to be purely humanitarian and literally humanity first.
Did you at any one point create synergies, say like where you were, where the medical camp was, like work in tandem, say with the Health Center 3 or Health Center 4 or 2 that was prescribed as the one for that area, to see that maybe they can also get empowered to hold this kind of camps? Because if this happens once in a year, then what happens during other days? For them to be able to maybe call out to other institutions to come in and support? You
are absolutely right. So, as we've heard, these are long-term relationships. These are not one-off. Yes, it is when we say one where we've had physicians from the UK, but we have our physicians here in Uganda also. So we coordinate with the local health institutions. A lot of that coordination can happen remotely. A lot of that, so the DHO, the District Health Officer's representative, was here over the course of and we discussed long-term how we can assist, that long-term communication. So it is the key, as you said, long-term, not in and out. The in and out, the camp happens, the camp goes, but when the camp closes, the work is continuing in the background.
Yes, true.
That's the key.
Oh, that's fantastic. Okay, now I'd like to hear from you your final take-home message for a person watching you right now. What would you like to share with the viewer?
For whoever is watching this program, I would like to appreciate you for sparing some time for us, and then being with us during this program. But my call is out there that you don't need to be very rich to change your life. You don't need to be extremely experienced to offer any service. You don't need to be extremely exposed to cause an effect. All that needs you to be is a human being. And being a human being means to not only take care of yourself, but of your neighbor. Uganda is largely a religious community. We believe in these principles. Take care of yourself, take care of your neighbor, love yourself, love your neighbor. So this does not only end in words, but it has to be put in practice. So whoever is out there, you need to we request you to join the Humanity First call. You need to be always ready to support your neighbor, to support your family, to support the people you stay with. And whatever you have, whatever form of donation you have, it can be in form of finances, it can be in form of your expertise, it can be in form of whatever you can offer. Always we have this chance. So, and don't think that you need to have a lot of money to cause a difference. No. 10,000 can help doctor reach out someone in Buwangala and give that health facility. 10,000. 200,000 can change a life for a teacher who had stopped teaching because they cannot see. And we have even monthly subscriptions, we have monthly donations. People, when we came here, doctor had to first donate. This is what I was explaining. He had to, if you saw him, pulled his phone very fast and made some, in Islam we call it sadaqah. He had to make some donations. So this is what we're saying. There is no one special to do that. It's us. So we have our accounts. You can give any, if it's monthly, whatever you can give. Like I've told you, we have students in school who are paying 270,000 per term. You can imagine how you can be able to educate someone. We have orphans in Kabende who need barely 300,000 to survive for a month. And this can change a lot of lives. So whoever is out there, don't look at yourself like you're incapable. Whatever situation God has put you in, you are at a higher height. You are at a higher phase, a higher level from someone else. So look at those ones who are down. If you can afford shoes, there's someone who cannot afford saloparts. If you can afford a cloth, there's someone who cannot afford a cloth. So if you have clothes, you start with that. All we want, all we cry out is to create a community that is not selfish, that is not self-centered, a community that thinks outside, that takes care of others, who come to accept that today it's me, tomorrow is someone. So I want people to treat me the way I treat them. And the God we serve is never blind. Whatever you do, he pays you in even more times.
Yeah, true.
Yes.
And today is you, tomorrow it could also be still, you know, it can be the reverse. Yes, Dr. Your take-home message, because we would like to thank you so much for taking time off your busy schedule. We know you're doing preparations to fly back to the UK, but you said you have to come to UBC.
So first of all, I'd like to thank you and thank UBC for giving us an opportunity to share with the Ugandan nation that sense of humanitarianism. Secondly, I'm indebted to Humanity First Uganda, our team as well, for the huge amount of work that they do. We feel honored to support them in some small way. And finally, I would say to the whole Ugandan nation, you're a very proud, great nation. There is nothing that cannot be done from within, as you've heard here. So we would urge everybody to join us on this journey to help.
Okay, thank you so much. Thank you so much for your time. Thank you for sharing. And thank you for the wonderful job you've done at the Free Medical Camp.
Thank you.
Well, we can see that a lot is being done in terms of giving back to the community. It's compassion, you know. When you have that heart to give, trust me, you will also receive. I don't think I need to say anything more. I'd like to hand you back for our normal programming and enjoy the rest of the day. It's a Friday.
Live from UBC Studios in Kampala, this is Good Morning Uganda Extra.
UBC, inspiring Uganda.
Exercise can't be sustained. Eating can't be stopped. It's even harder to lose weight. Come and give it a try. Ginshikang L-carnitine chromium capsules, plant extract, scientific ratio, take 3 capsules each time. The active ingredient accelerates fat burning, eat twice a day, don't take a detour. Weight loss starts now. Ginshikang L-carnitine with chromium capsules helps you stay in shape. Please follow medical advice when taking this product. For more information, visit our website www.hgo.com or call 0800 335555.
My question is, what is the difference between rental tax and income tax? How comes I'm paying both taxes on my own premises? If you want to have a tin, but you are not making any income from your business, you should take on the obligation to continue filing your nil return.
Commissioner General, to invest in taxation. When people understand taxes and they know the importance of taxes and they know the fair assessment